BOI 2 News this morning.
6:12, continuing our coverage of refugees in our community. Before coming to Boise, refugees are given a mandatory health exam overseas. But what happens after they get here? Here's what health services are available to them in the U.S. Within the first couple of months of being in Boise, it's important for refugees to come here. Family Medicine Health Center off of Emerald. It's a federally qualified health center, and it's the only one in Boise where refugees are introduced into our healthcare system.
Post-arrival exam.
Margaret Mortimer is a nurse practitioner here. She says there's a two-part post-arrival exam refugees go through when they come to Boise. First, there's an initial nursing visit with lab tests, an immunization status check, and a mental health exam. Then that person will come back a second day and get a physical exam. Mortimer says that mental health check is the most important many times.
A huge part of everything that affects their care is what they've been through and in trauma and mental health and helping with their adjustment here, because that affects everything with their health as well.
Then after those initial visits, for many, this will become their primary care. And as I mentioned, it's important for them to get here within the first couple of months.
They're very afraid of, having a service like Medicaid and then losing it.
Because every refugee who comes to America is given access to health care for their first 8 months. After that,
we have ways to help with sliding fee for more affordable visits and services, but it's still a barrier because they have to pay something.
And other barriers for refugees here?
Even English speaking, our health system is difficult to navigate.
An interpreter doesn't show up, the doctor can't communicate with the client.
Maya Mackey is the medical caseworker with the International Rescue Committee.
Transportation is a big one.
The resettlement agency that the refugees come to Boise through helps a lot. Maya and her team of volunteers help set up appointments for refugees, offer rides to those appointments, make sure an interpreter is there if needed, and anything else they may need. And once they're here to help, the Family Medicine Health Center has a pharmacy right inside, so there's no confusion on what to do with a prescription.